Every Friday, we open up our email inbox. This is a tradition that was established in the very first week of Real Talk, and since that very first week, it's been presented by our friends at Local Environmental Services. We call it Trash Talk! All right, this one's a healthcare edition of Trash Talk. This is just the way that it worked out. Laura writes into the show. She says, Ryan, it is with sadness and honestly anger that I write to you today. I'm a retired nurse, 40 years of employment behind me. I absolutely loved my career, which allowed me to specialize in a number of areas of care. I've also been waiting months for a hip replacement. And today I want to address the myth and the blind trust that people have with regards to the management of our healthcare system. Let me be honest where I stand politically. I've always been a little left of center, but that doesn't really matter when you're talking about healthcare. It shouldn't be politicized. We've got a management team that was hired to make decisions in our best interest, and this has not been happening. She says over the past 2 years, our healthcare system's been shut down, staff reorganized, programs stopped, we were on hold, right, because of COVID. And this caused more suffering, it seems, than COVID ever did for a lot of the people involved. You know, moving staff from A to B may work occasionally, but it's like mixing apples and oranges when you're talking about areas of specialty. Once you specialize in nursing, it's inefficient and ineffective to be pulled and plopped into another area and be expected to perform. It's a waste of time. It's a waste of staff. Programs could still have run. There was no need to shut things down like they did. Now, I can't speak to staff sick time regarding this matter, but I just say, as we face waiting times for surgery and diagnosis, etc., people are suffering because of poor management. And there are problems that you need to hear about, and there's some that you do hear about in the news, and it's always politicized. Why are we not demanding that management speak to this? Give us the reasons, and if you foresee problems, then let's find out who needs to be accountable. That's why they have the expertise at a good dollar, I might add. Healthcare's become this bottomless pit where nothing changes, and it's always the government's fault. Well, I'm sick of it. Healthcare's run according to budget. Why can't we change that to the number of procedures done and look at increasing that? Let's look at service and how it's delivered. Let's demand more from people at the top. We need a shakeup. We need to look after me, my loved ones, people I don't even know in reasonable time and reasonable fashion. And if I want to pay for something like a hip replacement, why not? It opens up a space in public care. You're talking my language, Laura. She says it's a win-win solution. Australia has this system and it works great. Ryan, thanks for taking the time to hear me out. I'm hoping that the people listening to Trash Talk will now question the people who have been hired to deliver healthcare services. They've got a huge budget to do so. Let's demand more from them or show them the door. That from Laura. And this one from Kelly, who says this mandate letter that everybody's talking about with regards to the Alberta government, how is this going to help Minister Shandro help the province with the very real challenges that we're facing as citizens? Rising costs, collapsing healthcare under the weight of a preventable, transmissible virus that the government continues to deny the gravity of. How does allocating funds into the priorities in this mandate letter make any sense to anybody? The actual real problems people face are lack of access to public defenders, lack of access to courts to get justice, lack of supports for people to avoid getting involved in the justice system, lack of money for existing services to improve. Instead, more chasing ideological windmills. This Sovereignty Act that the Premier's talking about is going to kill investment, period. It's embarrassing the depth to which our conservative politicians have gone dumbing down and pretending they don't understand how the separation of powers works in this country. Frankly, says Kelly, it's insulting. This Alberta police force is going to cost billions in lost federal funding. The cost of setting up training, administration of a new force is a ridiculous waste of money. We need mental health training. We need support for police being called out to mental health and addiction calls. Where's the fiscal conservatism in turning down $300 million a year from the feds for policing? Protecting unvaccinated persons as a protected human rights? That demonstrates a lack of understanding of the intent of human rights protections and the duty of care that government and business has to protect the health of the people in their charge. I'm a business owner, says Kelly. I have a legal duty to minimize risk to my staff's health while performing their work. WCB and insurance require this duty of care. As a decent human being, it's imperative. Vaccines save lives. They're the number one reason after basic sanitation that human life expectancy rose above the age of 40. mRNA vaccine tech is already revolutionizing how researchers are tackling other diseases. The Alberta government's required vaccination for a multitude of professions in your employ, including nurses, doctors, EMS, correction staff, for decades. Why is our government embracing misinformation toward this particular vaccine instead of providing rational leadership? And denying the fact that plastics are toxic? We've not talked enough about this, by the way. Are you people serious? Asks Kelly. We need serious people to solve serious problems. Plastics are toxic. You know it. I know it. We all know it. We need them. It's a potential value add for the Alberta economy, but we need to stop throwing it out and clogging our waterways and oceans. We need to eliminate single-use plastics and concentrate on durable and high-tech uses. We need to use, get this, facts and science to make our decisions. That from Kelly. Facts and science to make decisions? What will they think of next?